This video gives information about laser corrective surgery, the types, the procedure, possible side effects, and complications. In order to understand this, let us go into the basic, understand how an image is in the eye. So here, as you can see from the diagram, the light enters the eye from cornea and through the lens. It converges to a point. This point focuses on the retina so that a clear image is formed. This patient will see clearly without the need of any glasses. Now let us see what happens if the patient has myopia or minus power in his glasses. So we see here the light enters the eye, but it converges in front of the retina. Now the point of convergence, because it is in front of the retina, needs a concave lens to push it back on the retina. So as a result of which, a myopic patient needs a highly concave lens depending on the degree of myopia to push the point of focus on the retina. Now let us see what happens in hypermetropia when the patient needs a plus power to see clearly. In this case, the rays of light fall behind the retina. Now to bring that point focus on the retina, patient will need a plus power glass or a convex glass or lens. And these are the patients who are called as hypermetropes. Having understood this basic optics of the eye, let us see how this laser actually works. So the laser procedure is done on the cornea, which is the front converging surface of the eye. So what the laser does is it changes the curvature of the cornea so that the point of focus is shifted either back in myopia or in front in hypermetropia. So what it does is, in the myopic patients, it makes the cornea more flatter so that the convergence is reduced and the point of focus goes in the retina, whereas in hypermetropia it makes the cornea more steeper so that the light converges more and the point of focus, which is behind the retina, comes on the retina. The end result in both the conditions will be that the patient will not need any glasses further. Now, laser refractive surgery has been considered to be a surgery which has got highest patient satisfaction rate, which is almost more than 95% amongst all elective surgeries. Eligibility for refractive surgery. A patient should fulfill certain criteria which are extremely important. These are also important from the safety point of view. Candidate should be more than 18 years. The power values should be between +5 to -12. You should not have any eye diseases like keratoconus, glaucoma, cataract, corneal diseases, dry eye, and certain retinal and optic nerve conditions. Should not have any residual or active eye condition, including optic neuritis, ocular herpes, amblyopia or lazy eye, or squint. Also, the candidate should not have any recurrent eye allergy, should not have any autoimmune diseases like lupus, rheumatoid arthritis, multiple sclerosis. If the candidate has diabetes, it should be well managed and under good control and should not have diabetic retinopathy. And if the patient is pregnant or nursing or planning to become pregnant in the next 6 months, it's better to avoid any form of refractive surgery. Now, refractive surgeries are of two types: photorefractive keratectomy or PRK is one form of procedure. Now, this is the earliest form of refractive surgery. Here, as you can see in image number 2, an instrument is used to remove the epithelium of the cornea. In figure 3, the laser is applied, and in figure 4, after the completion of the procedure, you can have an epithelial defect, a deficiency, which takes about 3 to 5 days to recover. So during that time, a lens is applied on the cornea. In the first 24 hours, patient may complain of pain and or discomfort, As we discussed, bandage contact lens is applied for a period of 3 to 5 days, which is applied by us and removed by us. Initial 2 weeks following the procedure, vision may remain blurred, and around 4 weeks, it will ultimately improve completely. Now, let us look at LASIK. So, in LASIK, what happens is the epithelium is not touched. So, in figure 2, what you can see is a partial thickness flap of cornea is created and it is lifted. This flap can be either created by a instrument called as microkeratome or it can be created by a femtosecond laser. Now we can see figure 3. So once the flap is lifted, the area which is exposed is then treated with the laser beam. So the laser process continues depending on the amount of correction that one has to do. For example, a 10 diopter correction may take about 20 to 25 seconds. Once the laser is completed, the flap is kept back in its original position, and that is the completion of the procedure in one eye. The flap and the bed position takes about 2 to 3 minutes. So in all, if we take the step of laser flap creation takes about 10 seconds, the laser application takes about 10 to 20 seconds, and flap repositioning takes about 2 to 3 minutes. So in all, this procedure lasts for about 4 minutes, and preparation to completion in all takes about 10 minutes each eye. Very important to understand that both these procedures are absolutely painless procedure because the eyes are numbed by an anesthetic drop. Patient really doesn't feel any sensation. Only thing patient will realize is something is happening in his eyes. Occasionally he may have a little bit of heaviness. That's all. Now this table gives us the comparison between PRK and LASIK across various parameters. So if we look at pain and discomfort, LASIK is definitely more comfortable and patient becomes functional from day to itself. Whereas in PRK there is pain and discomfort lasting for at least 24 to 48 hours. We need to put a contact lens in a patient with PRK for at least 3 to 4 days, whereas in LASIK a lens is not required. Functional recovery happens in 1 to 2 weeks in PRK patients, whereas LASIK patients sees clearly from next day itself. The refraction or the power becomes stable in 1 month's time in PRK, whereas LASIK it may take up to 2 weeks. PRK is good for patients who have thin cornea and have low errors of refraction. So is usually given an option for patients whose power is less than -6. LASIK has much wider criteria for correction. You can correct up to -12 with LASIK. Intraoperative complications are not there in PRK, whereas in LASIK, flap-related complications can happen. Postoperatively, there is no major complication in PRK, except in very few individuals, corneal haze can happen. Flap displacement, spontaneously or trauma-induced, is always a risk in a patient with LASIK. PRK is good for people who are into contact sports or who are in combat situations, for example, people in police force or army. LASIK is ideal for people who are looking at very fast visual recovery so that they can get back to their normal lifestyle. We look at the post-op course in patients after LASIK. Vision improves the next day, and uh, the complete recovery may take about for a few more weeks. Patient may get back to their work in 2 to 3 days after treatment. Reading and computer viewing is permitted from second day itself. We advise patients to avoid water contact for at least 2 weeks and wear a protective glassware. Water sports should be avoided for at least 3 months. Patients may experience sometimes fluctuating and blurring of vision, which settles down with time as the healing process improves. In LASIK, the risk of complication is very less than 1%, and the complication, if at all it happens during the flap creation. So you can get either an incomplete flap creation or a free cap when the flap totally separates from the cornea, and sometimes buttonholing of the flap. In the event of any of these issues coming up during the procedure is then abandoned and further laser is not given for the simple reason that the area needed for the laser application may not be sufficient enough. So at that point, surgery is abandoned and then a surgery can be replanned after a period of 3 to 6 months. LASIK induced dry eye is seen in almost all patients. It usually persists for about 6 months and patients have variable sensations like foreign body sensation, burning sensation, and occasional fluctuating vision. Patients will have to use artificial tear substitute for a period of at least 6 months. The frequency will vary depending on the severity of dry eye they suffer. Another rare issue that can happen is undercorrection, which is very rare. Patient may need a very small power for seeing very long distances. In some cases, repeat laser treatment can be done. This procedure is called as enhancement procedure. In some patients, they may see nighttime or night vision symptoms like starburst and halos. Now, this can happen in a very small percentage of patients, but over a period of time, this reduces. It does not in any way affect the functional vision of the patient. PRK patient may have a very rare issue called as PRK haze. It can sometimes cause visual impairment. To prevent this complication, for first 6 months, patient is suggested to use glasses which avoids UV light. Ectasia of cornea. This is a post-Lasik or a post-PRK ectasia. Is nothing but bulging of a portion of the cornea over a period of time. Now, this is the rarest of rare possibilities, and it can happen in 1 in 5,000 procedures. Now, as you can see from the figure, there is a bulge in the cornea as shown by the line. Now, this condition would need intervention. So, to conclude, laser refractive procedure is a very successful procedure which will help patients to get rid of their glasses. This procedure has been in vogue from 1991 throughout the world, and every year lakhs and lakhs of people get it done to improve their quality of vision as well as quality of their life. Very important is to understand this procedure, pros and cons, and follow the advice given to have a good successful outcome.